Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director, providing you the update from Albany Medical Center. Today is Thursday, June 11th. So Fred, we're going to be doing Tuesday, Thursday now. This is our normal cadence.
It's our cadence.
This is our normal routine. As always, though, we'll start with the numbers of COVID-19 in the region. We'll pop up the first graph here. This continues to be a very good news story. You can see currently in the 8 counties of the capital region, there are 48 people being treated for COVID-19, and there are only 4 in an ICU. So those numbers have definitely come down. The next graph is another one that you're also familiar with. This is the experience inside Albany Medical Center. Above the line are new cases coming in, and below the line are cases that have left the hospital. And currently you can see that we have 25 people in the hospital that we're currently treating for COVID-19, 22 on the floor. We have 3 in the ICU. We have 1 on a ventilator. So again, those numbers are definitely lower than the apex. Fred, congregate living facility, and this is on the next graph, congregate living facility, we currently have 10 people in the hospital who are positive for COVID, but we're not actively treating, which really means at this point we have 15 that we're currently treating in the hospital for COVID.
That's right, Dennis. 15 actively ill patients being treated for COVID. That's it.
And as we talked about on Tuesday, that's about 1 in 40 patients in the hospital.
That's right.
And it's allowed you as the hospital director to really cohort them down into a couple units.
So we're now in a single unit with those patients. So we've closed C2, the other COVID unit, and now we're reopening that for its usual patients, the colorectal patients.
Fantastic. One of the benefits of doing this video on Thursday is we can talk about Journal Club, which continues to happen on Wednesday night. Last night we had a special guest, Dr. Liza Whalen, and it was about contact tracing.
Contact tracing and actually testing for COVID, both the serology as well as the PCR testing. It was really terrific, Dennis. The medical students really go all out in terms of the information they pull, and I must admit they put it into a format that's so very understandable. There are a couple of interesting things brought up. So in terms of contact tracing, if you do it well, in a way it's like herd immunity, because you prevent the spread because there are no new hosts for the virus. And then the other thing that was very interesting, it was the concept of pre-test likelihood affecting post-test likelihood. So no test is 100%.
Nope.
And it's the same thing with these PCR tests. If they're 80% likely true positive, that's influenced by the pre-test likelihood of whether or not the patient has COVID. It's something called Bayes' theorem. We learned this in medical school in terms of how we interpret tests, so there was a little discussion of that, which was very good.
That's great.
It was really terrific. Liza did a terrific job, and actually Kathy Stelwick, the director of our molecular diagnostic lab that does all this testing, also spoke. They were really good.
That's great. So Dr. Whalen actually is a graduate of one of our graduate medical education residencies here. She did medicine here, so we're very proud of her. Speaking of testing, we received a great letter from the officer in charge of the site out at University of Albany, where a lot of COVID testing has been taking place now for several weeks. And he wanted us to know how proud he was of the work of our nurses. It's First Lieutenant Bishop. And Fred, why don't you read some of his comments?
So I have his letter here, Dennis. He starts by saying, I was compelled to write the leadership of Albany Med to express my deep gratitude and appreciation for the nurses who have worked the UAlbany swab site. He's the military officer in charge, as Dennis says. I have been continually impressed, he goes on, with the Albany Med nurses. Their professionalism reflects positively upon your organization. They've had incredible attitudes despite long hours, being cold, being hot, and being confined to the humble site that they were operating within. So it goes on further. I won't read the whole thing, but he just thinks our nurses are tremendous, and so do we.
So do we. So thank you to Lieutenant Bishop for writing that great letter, and thank you to our nurses who have done that great work out there. Fred, we sent a survey out to our workforce because one of the things that we're always interested in is not just sort of saying what we've done well, but learning what we could do better.
Absolutely.
It's always about trying to do better than we've done before. And so we're encouraging our workforce to tell us that, and I think we've already received a robust response from our workforce?
So the request went out by messenger at 11 a.m. yesterday morning to respond to this survey, and by 5 o'clock we had 579 responses.
Wow.
So just a tremendous effort on the part of our staff to give us information. I've read through a number of them, and I think you have as well. A lot of good information in there. There's some things that I think we're going to learn and do differently based on some of that feedback. More to come on this.
Okay, I look forward to looking at the survey results and sharing that with all of you out there as well. We were alerted that there was a podcast that was done, University at Albany's radio station, and it was focused on and highlighting the work of medical social workers who are very important in the treatment not only of COVID-19 patients, but many of our patients in the hospital. And that was sent to us by Mitchell Todd, who's Director of Case Management and Social Work, a great leader here. And Kevin O'Keefe, Hillary Charles, and Kathy Vasquez were three of our licensed medical social workers who were highlighted in the podcast. We're going to share that on social media, and
It'll be good.
Yep. Our workforce can learn a little bit more about the great work they've done. So thank you to all of them for that as well. Fred, we had a blood drive yesterday, and it was incredible, very successful.
It was a tremendous success. I have the numbers right here in front of me. We had 155 donations, 19 first-time donators,
That's awesome.
which is good. Hopefully they'll continue. Those 155 donations actually translate into over 400 patients that will receive that life-saving therapy, that life-saving treatment. The response was so tremendous that they didn't take any walk-ups yesterday.
They did not.
And so that had an effect on one of us.
Yes.
But they're coming back on June 30th, so mark that in your calendar. If you haven't donated recently, think about donating on June 30th.
So I got shut out.
I
I walked by and they said it's filled, which was great news actually.
Yes.
So we insisted they find another date, and they're coming June 30th, and they already have me reserved. But one of the things that we heard as I was walking by is several people donated because they heard about it on this video,
Yes,
which is great.
That's great.
And this is our workforce donating blood that's used here for our patients. So
Very important, particularly at this time of year.
for sure. Last topic, quality. We have an incredible quality department here. It's under the leadership of Dr. Patrick McNulty. There's two other leaders in that group, Dr. Megan Keenan and Todd Scrime, also very integral to that department. They've done some great work lately, and I think we want to highlight that.
Absolutely, Dennis. There are a lot of good things that come out of that department. We have a number of QITs, I think over 35 QITs. These are groups working on improving the quality of care we provide in different areas, and that's all organized.
Quality improvement teams.
Quality improvement teams.
Right.
That's all organized within that area. The other thing that's organized in that area is our registry reporting.
Yes.
So we report information on the quality of care that we provide to over 24 registries around the country. Cardiac, neurology, neurosurgery, etc. That translated into 5,500 abstractions, chart abstractions last year, where we gathered information and then reported on the quality of care that we provide. It's contributing to the information out there, but also we learn best practices from that as well.
We do. We learn of the things that we're doing that we need to do more of, and it's incredible. And in point of fact, Doctors McNulty and Keenan actually did a review of how we treated COVID-19 patients lately, and they produced a document about that shows our results that we're going to be sharing as well.
Yes, yeah, really very good effort on their part. Really very interesting information in there.
So shout out to quality for sure.
Good job.
And the people on the front lines who are providing the care as well.
That's right.
Okay, very good. That'll do it. This is our new way of doing business, COVID, non-COVID. And over time, hopefully we'll be talking about even more non-COVID topics going forward.
That's right.
But we'll be back again Tuesday. And we've already picked some topics to talk about on Tuesday as well. So that'll do it. We'll be back again next week. We look forward to seeing you then. As always, please take care of yourself, take care of each other, and we'll see you next week.